It's Roberto Miki again, and we've got another question for you in this series of questions for medical students, residents, and fellows training for the boards or in-training exams. Without any further delay, let's get to the question. During a distal biceps tendon repair, which nerve is most frequently injured? A. Posterior interosseous nerve, B. Lateral antebrachial nerve, C. Median nerve, D. Anterior interosseous nerve, or E. Ulnar nerve. Here's your chance to pause the video so you can answer the question. All 5 nerves listed in the question can be injured during a distal biceps tendon repair. The most commonly affected nerve, however, is the lateral antebrachial nerve. Neuropraxia from traction, scar tissue, and direct injury are common. Around 10% of single incision distal biceps tendon repairs will experience a neuropraxia of the lateral antebrachial nerve. This is a diagram of the sensory innervation of the skin, and the brown with these purple arrows is the lateral antebrachial nerve sensory distribution. As you may recall from anatomy class, the lateral antebrachial nerve is the terminal branch of the musculocutaneous nerve, which is depicted here by these red arrows. Musculocutaneous nerve is sitting deep to the biceps and superficial to the brachialis. In this drawing, the purple arrows demarcate the biceps tendon, which has been transected to allow us to see the musculocutaneous nerve directly behind it. This is a cross-sectional anatomy drawing of the same lateral antebrachial nerve or musculocutaneous nerve sitting directly behind the biceps but superficial to the brachialis muscle. The lateral antebrachial nerve must go from deep to the fascia to superficial to the fascia, and it does this by piercing the fascia just lateral to the biceps tendon. It is this close proximity to the distal biceps tendon that leads to its propensity to be injured during distal biceps tendon repairs. So the answer is B, lateral antebrachial nerve. Thanks for watching, and we hope to see you at the next one.